Hello, my name is Calissa Bennell, and today's presentation will be on sexually transmitted diseases. There are a number of sexually transmitted diseases around the world, but the ones listed here are the most common ones. There are 4 ways a person can acquire an STD: through sexual intercourse with penetration, oral sex, touching of the genitals, and through other bodily fluids. Let's talk about a few facts about STDs. In the 70s, only 1 in 47 people had an STD. That is about 2% of the population. In 2012, 1 in 4 people had an STD. That is a quarter of the population. 15.3 million people a year are diagnosed with one of the many different STDs, and an astounding 50% of the population will have an STD at some point in their lives. HPV and herpes are the most common STDs, and the average age a person acquires an STD are between the ages 16 and 24. There are 2 types of STDs, viral and bacterial. Bacterial STDs can be treated with antibiotics, but for viral STDs, such as HIV and HPV, there is no cure. But the good news is that they are preventable. Most STDs can be prevented with a vaccine. Take human papillomavirus, for example. There are 2 vaccines to prevent HPV, Cervarix and Gardasil. Cervarix is for girls and women only, but Gardasil can be for young males as well, and both are recommended for age 9 to 14. The reason why the age group intended to receive the vaccine is so young is that doctors would like to vaccinate adolescent girls and boys before they have a chance to be exposed to the virus. In a woman, HPV only infects the lining of the cervix, but does not infect any of the other organs in the body. This is important because HPV is the leading cause of cervical cancer, and cervical cancer has the second highest rate of death behind breast cancer. HPV is the cause of 5% of cancers worldwide. Another way to prevent HPV is to be in a monogamous relationship with an uninfected partner, or to abstain from any type of sex altogether. Research in transmission of HPV has proven that condoms during sexual intercourse may not completely protect the transmission of HPV because areas not covered by the condom can be infected with HPV. Surprisingly, there is only one symptom for HPV, and this includes warts or blister-like skin conditions in the mouth or genitals. Another sexually transmitted disease that is very dangerous if it is not prevented is hepatitis B. Hepatitis B is a sexually transmitted disease that infects the liver and, if untreated, leads to liver cancer. Currently, about 1.25 million people in the United States are a carrier of hepatitis B. The symptoms of hepatitis B are jaundice, fever, unexplained fatigue, and abdominal pain. Although about 30% of infected persons show no symptoms at all and can only find out through a blood test. Hepatitis B is one of the few STDs that can be treated after exposure to the virus. If caught within 2 weeks after exposure, a vaccine called immunoglobulin can be given. It is a short-term vaccination to protect a person for 3 months. There is a more permanent long-term vaccination which should be given to babies and young adults. Studies have shown that this vaccination lasts for longer than 6 years. Also, for chronic hepatitis, drugs can be given to slow down the virus from liver damage. The next disease we are going to talk about is different from the 2 we just talked about because it is bacterial and not viral. This disease is gonorrhea. Gonorrhea infects women and men alike. The symptoms in men are burning sensation during urination, swollen genitals, and a greenish discharge. The symptoms in women include burning sensation when urinating, abdominal pain, bleeding between periods, red itchy eyes, swelling of the external genitals, and green discharge as well. Gonorrhea is both treatable and curable. Although, if left untreated, gonorrhea can be life-threatening. Untreated gonorrhea in women causes pelvic inflammatory disease, a disease which infects the uterus and the fallopian tubes. Untreated gonorrhea also increases the risk for ectopic pregnancy, which is when a fertilized egg implants on the outside of the uterus or in the fallopian tubes. Both of these conditions can cause infertility in women. If a woman gets gonorrhea while pregnant, premature delivery may occur or even an unexpected abortion. Untreated gonorrhea in men can also cause infertility due to damage of the testes and scarring of the urethra, making urination difficult and painful. Another bacterial STD is chlamydia. Chlamydia is the most easily spread STD because there are usually no symptoms, so an infected person may not know they have it before engaging in sexual intercourse. 75% of people infected have no symptoms. The other 25% have the same symptoms as gonorrhea mentioned earlier. These symptoms are burning sensation during urination, swollen genitals, abdominal pain in women, and greenish discharge from the genitals. The good news is that chlamydia is treatable with antibiotics such as azithromycin and doxycycline. If chlamydia is left untreated, then infertility can occur in both men and women. Another bacterial sexually transmitted disease that I will be talking about is syphilis. Syphilis is another STD that is caused by bacteria. There are 4 stages of syphilis: the primary stage, the secondary stage, the latent stage, and the late stage. The symptoms for the primary stage are open sores called chancre. These open sores can appear in the mouth, the anus, or the genitals. The secondary stage occurs 2 to 8 weeks after exposure to the infection, and this is the time when skin rash develops on the spots of infection. Studies have shown that the latent stage, also known as the hidden stage, lasts for at least a year if untreated. Some people stay in the latent stage for as long as 20 years without knowing they are infected because there are no symptoms during this stage. Lastly, the last stage is the most dangerous. The last stage only occurs if syphilis is untreated. This stage can cause serious health issues such as blindness, mental disorders, nervous and heart disorders. Some cases even lead to death. Just like the other bacterial STDs, syphilis can be treated with antibiotics. The last STD that I'll be talking about is one that still has a doctor's stumped: HIV. HIV is a virus that is always mutating, making treatment difficult. The virus infects a person's immune system so they cannot fight off diseases or illnesses as efficiently. HIV was discovered in 1981, and more than 3 million people have died since. Most symptoms do not occur until the virus has gotten to a severe stage. After learning about the different types of STDs, there are common ways to prevent them. These ways are practicing safe sex, abstaining from sex, and getting yourself tested. That way, you and your partner can be STD free.